start with Christie.
Hi guys, my name is Christie Rivera. I am a first-year medical student at the Warren Alpert Medical School.
Wow!
I will be sharing a few words about my experience as a documented student. It's a cold New England Tuesday afternoon at Clínica Esperanza, a free clinic providing healthcare to the uninsured in Providence, Rhode Island. A middle-aged couple hands in their paperwork as the intake volunteer, and I, the Spanish translator, guide them towards the intake room. We sit down and begin the intake process. As we move on to the social history questions, the couple begins to open about their immigration status. With some hesitation, they speak about not seeing a primary care physician in years due to lack of health insurance and their immigration status. As I translated, I remembered leaving friends and family in El Salvador as my sister, mother, and I embarked on a one-way flight to Maryland in 2001 when I was 8 years old. We continue with the social history questions as a couple is prompted to comment on their living situation. They disclose that they rent an apartment with relatives who also immigrated to the United States. At this moment, I remembered the 3 months my family shared a room in an apartment in the basement we lived in for another 3 years. It wasn't until 15 years later that my parents were able to live in a house. We continue the intake process with questions about their health status, which I joyfully attempt to answer in broken English. I recall times when I accompanied my parents to free English classes on weekends and weekday nights at a local high school. This was a helpful complement to the ESOL classes I was taking at my elementary school. Back at Clínica Esperanza, towards the end of the intake process, the woman asked me about my background, where I grew up, and where my parents lived. My parents, sister, and I immigrated to the United States in search of opportunities and a safer environment than a violence-troubled country. From an early age, my mother taught me that hard work, a love for God, and caring for others is essential in order to positively contribute to society. However, as I grew up, I came to the dark realization that exemplifying these values is not enough in a society where gender, skin color, immigration status fuel prejudice and a cycle of poverty and disadvantage for those underrepresented. I learned that my uncle had not gone to a primary care physician in years due to a lack of health insurance arising that was a norm for many adults in my community who were also undocumented. I desperately wished there was something I could do for him, others like him, who were kept from receiving this basic human right. During our first few years in the United States, my mother took my sister and me to children's free clinics for our annual physical examinations. Doctors volunteering in these free clinics who care for children like my sister and me are part of my inspiration to become a physician. I am driven towards becoming a physician advocate dedicated to working with underserved communities. Furthermore, as a Christian, I am called to demonstrate love, compassion towards others regardless of their race, gender, ethnicity, and immigration status. Back at Clínica Esperanza, the couple nears the end of the intake process. I speak with them as the intake volunteer completes their assessment. Soon after sharing that I also immigrated to the United States from El Salvador, they eagerly ask if I am a dreamer. Caught off guard by the question, I chose not to disclose this information. Growing up, I was told by my parents not to tell anyone about my immigration status. Reflecting back on the experience, I wish I had shared my experience of being an undocumented immigrant who was granted DACA status 4 years ago, thus allowing me to have a license that I can use for air travel within the United States, a social security number, and a work permit. I wish I had shared with her that uncertainty was my reality too. DACA was never a permanent solution. Trump's decision to end DACA this past week directly prevents me from becoming the physician advocate I aspired to be. Without DACA, I and roughly 70 other medical students cannot work in the United States and therefore cannot continue our medical training upon graduating from medical school. Coming to this country was not an easy choice. Simply put, it was paramount to our survival. Even so, America, the country we chose to adopt as our own, continually rejects us. We struggle to make the government see that we too are human beings who deserve to be treated with dignity. As undocumented people, we wake up every day and endure disdain, discrimination, xenophobia in the hope that maybe one day we will be able to live in peace, continue to contribute to this country, and be recognized as American. This issue is not about political beliefs. It's bigger than that because it's about sympathy and love. I urge you to think critically about this issue, allies, and I encourage you to stop thinking of us only as potential assets to this country who contribute financially and intellectually. I want you to look at our shared humanity and experiences as collective people of the United States and understand that we deserve better simply because we are human beings. Thank you.